Well, you made it this far. You're here listening to my pre-op video for rhinoplasty and revision rhinoplasty. The most important thing that I want you to know is that this is elective surgery, and you and I are in this together. And we're going to be in this process of healing for up to 3 years. That's right, 3 full years. So when it comes to either first-time rhinoplasty or your 10th rhinoplasty, I want you to know certain things. First of all, you have to follow all the directions. Make sure you read everything before your procedure, because that's really important. You want to have all your medications lined up. You want to know what to expect so that you don't get worried following surgery. And in general, usually there's not a lot of pain with rhinoplasty. Many of you will have rib harvested, and that's going to feel like you did about 1,000, sit-ups. Also, what's important is to make sure that someone is helping you, especially for the first few days following surgery. You don't want to do a lot of activity. You want to take it easy. You want to relax. And also, you want to make sure that you or your loved one is helping you clean your nose following surgery. You want to make sure your incisions look great. You want to make sure you're using the right antibiotic ointment inside your nose. You want to irrigate, and you want to take all your medications. So let's talk about some of the bad things with rhinoplasty. Basically, it's risks. First of all, your skin heals differently than anything in your body. What does that mean? Well, there's something called three-dimensional healing and shrink wrappage of your skin, of the nose. That means your skin can heal, even one side of your nose can heal differently than the other. It's something that we can't control. And your skin will heal over a different time period. Usually, or in general, for the first year, you get about 75% of the healing. Between year 1 and year 2, you're going to have maybe up to about 90% healing. And even up to year 3, you're going to go another 10% and have more healing. I've watched skin of the nose contract and get smaller up to 3 years. And by the way, let's talk about skin thickness and swelling. If I have to pick one thing in my nasal practice that makes doing rhinoplasty very difficult and patients don't like it, is the nasal swelling. Sometimes your nose can swell up like a sausage right after surgery, or it can fluctuate day to day, even after a year or so. Your nose can be very swollen, and by the way, I'm only working on the cartilage underneath your skin. Now, your skin is very thin. However, whether it's your first-time rhinoplasty or you have thick skin or your blood supply is not that great because you've had more rhinoplasties, your skin can get very thick after surgery. And this is something that I want you to understand. Nasal tip swelling is not something that just goes away quickly. We're going to have to work on that together. There's things that we can do to help it with ultrasound, LED therapy, hyperbaric oxygen, and even Accutane use, low-dose Accutane by a dermatologist. These are things to help your nose heal. But no matter what, your nose is not going to be perfect. It's not perfect now. No matter how great of a job that I do in surgery and I take photos and I look at your nose, it's still not going to heal perfectly. That's because of the three-dimensional healing and shrink wrappage of the skin following surgery. So let's say I take photos and your nose is very symmetric. Well, guess what? In 1 year, this side may go in more than this side, or this side may have more swelling than that side, or you could have more broken blood vessels, or the scar may not heal perfectly. I can guarantee you that you're going to have asymmetry and irregularities of your nose after healing. No matter how great your nose looks right at the end of my surgery, and by the way, I take photos of your nose, I'll sit there and put it on the big screen and I'll look for any asymmetry. And I'll do the best I can to make it as symmetric as possible. But as you heal, you are going to have asymmetries and you are going to have irregularities. Your nose is not going to be perfect. One side may heal differently than the other. For example, even on my nose, which I've had about 4 rhinoplasties, this side goes in more than this side. I can breathe better out of this side. My skin is nice and sharp here, but no matter what, it's going to heal differently because your skin is different than my skin. You might have thick skin, and that's going to be something that's going to possibly make you constantly worry about and basically say, Dr. Nassif, when is the skin swelling going to go down? I'm not 100% certain. It could take up to 3 years. Your skin reacts differently to surgery. The more surgery you do, or the thicker your skin, or the more sebaceous your skin is, that can increase nasal tip swelling or edema. The actual thick mass of the skin, which is the layer, what we call a fibrofatty tissue, can actually increase in size. And that's why we offer LED therapy, ultrasound, hyperbaric oxygen, and for the cases of nasal tip swelling that are very severe, we send you to a dermatologist or your dermatologist to consider using low-dose Accutane. Some of the basic risks associated with rhinoplasty surgery is irregularities and asymmetry during healing, chronic swelling, broken blood vessels, infection, nosebleeds, a hole in your septum called the septal perforation, irregularity of the nasal bones, little irregularities of the nasal tip, thickened skin, a poor scar, and even the need for revision surgery. Across the country, the average person that has a rhinoplasty, there's about a 22% risk of them having a revision. In my hands, it's probably about 10%. Even though I look at your nose on the table and I'm happy with it, there's still things that could make you heal not the best way. And this is your own body. That's where the three-dimensional healing comes into play. In addition, you may need a revision. And if you need a revision, I will say to you, you may need a year or 2 years before I think about touching your nose again. I'm not doing this just because I say, well, I just want to wait. I'm doing this for your own good. I'm making sure that your swelling and your healing goes down and we see the natural issues with your nose before you need a revision. Hopefully you won't, but this is something that can occur. I want you to understand that a revision, sometimes something that happens, and if you're that patient, you're the one. In addition, the skin of the nose. One of the things that I deal with as a rhinoplasty surgeon, probably more than anyone in the world, is compromised nasal skin. What does that mean? If I'm doing your second or third or 10th rhinoplasty, it's rare that will happen the first time. The skin of your nose sometimes doesn't heal well. It can turn purple. Worst case scenario, it can turn black and die. It's called nasal tip necrosis. We have many things that we can do to help that as soon as I see it. It may include using hyperbaric oxygen, ultrasound, LED therapy, even using leeches. If you have nasal tip skin compromise, you're in very good hands because we have more experience than that than anyone in the country. Now, I'm not trying to scare you about this, but if you've had multiple surgeries, your skin basically doesn't have the best blood supply. Some people will heal differently than others. And if that happens, we're going to identify it immediately, and we're going to give you numerous treatments and discuss different ways to help you heal your skin. And as you're sitting listening to this video, you're saying, my goodness, is this what it's all about? All these doom and gloom statements? But unfortunately, this is your pre-op. This is what we call informed consent. I want you to understand that these are things that can happen in rhinoplasty in addition to what you read on the consent. It's important for you to be realistic, that I can only do so much with your nose. And I want you to be realistic about your expectations, the outcomes, the what to expect with your nose, the healing conditions, and the possible risks. That's what's going to make you a good candidate for surgery. Now, obviously, what am I going to do? I'm going to do the best job possible. I'm going to take photos of your nose. I want to stare at your nose to make sure that everything is absolutely as perfect as I can make it. I'm going to make sure your breathing airway passage is also good as I'm making your nose look better. These are the risks in complication of nasal surgery, and obviously I hope that none of these happen to you except for the normal healing course, which is swelling, and there will be some irregularities and asymmetries of your nose. Expect that, 100%. But I'm going to do everything in my power and my team's power to give you the best result possible and try to prevent any of these complications from happening, but I just need to make you aware of them. Thank you for listening to this video, and I'll be seeing you shortly.